Hi everybody, and welcome to the EHMA COVID webinar series. Today's webinar is going to be on the preparedness using accreditation implementation in hospitals for hospital management systems. So moving on, I'm George Valiotis. I'm the Interim Executive Director at the European Health Management Association. And the practical information for today's session is that everyone's microphones are muted just because that allows for a clearer, simpler running of the workshop. So although your microphone is muted, you can chat in the chat box as I've mentioned. Feel free to put in comments or questions or anything like that. We do record all of these webinars and we make them available soon after the webinar on our YouTube channel, but the easiest way is to get to it on our website. In fact, you can see all of the 9 webinars that we've run so far, as well as the future ones when they happen, at ehma.org/COVID-19-webinar-series. Now also you'll be emailed with these links afterwards, so they should all the information should be easy to get. Also on that page we store the video of this session. We also add any useful links, any key information, and a copy of the slides. So that should save you on some note taking, or if you want to come back and find any information. And then finally, we also tweet about these events. You can tag us at EHMAinfo, and please use the hashtag EHMA webinar so that we can keep track of things and stay connected. So today, we're talking about the accreditation implementation of hospitals. We're going to look at severe acute respiratory syndrome and how does accreditation help. I wonder if point B is a mistake actually in this. And then question and answers with the audience, and then we'll look at, to do that, we'll hear from Claudia Mika, who's joining us today. She'll present for 15 minutes and then there'll be a 10 minutes question and answer. So Claudia, welcome and thanks for joining us.
Well, good afternoon to everybody and thank you very much for the invitation. The title for today's web seminar is Better COVID-19 Preparedness through Accreditation and Implementation of Hospital Management Systems. And yeah, I gave it even another title. The subtitle, so to say, is why hospital managers of accredited organizations sleep better than those of non-accredited organizations. And I would like to give you a few points for this, let's say, hypothesis, why we think that accredited hospitals are better prepared for this COVID-19 pandemic than others. So we all know that we talk about this SARS-CoV-2 virus, that is the virus, and that the COVID-19 is the disease. So here on the slide you see today's numbers and figures. As I saw from the poll that most of us are coming from Europe, so we all have the same problem. We are expecting a second wave, and WHO published today the numbers, and we see that we had overnight more than 250,000 new cases all over the world. So this is a topic which will accompany us during the next month or even years. However, we have some experience, not with this new virus, of course, but from the past. And this is the reason, one of the reasons why accredited hospitals might be a bit better prepared than other hospitals. Why? Because we have experience, and the experts say that SARS-CoV-2 is similar to SARS-CoV-1, the epidemics we had in the years 2002 and 2003. So those hospitals and clinics that had to deal with this SARS-CoV-1 15 years or 17 years ago might know from the emergency preparedness what to do. This is one point. Then the transmission, it's via droplets, aerosols, and it's a quite stable virus. And the current literature says that activities were measurable up to 72 hours on plastic and iron. So this is infection control and infection prevention topics, which is a very important thing for accreditation bodies worldwide to see, and there are a lot of standards for this, which I will show you also in a minute. And this is rather new, how we deal with it. In German, we call it the AHA rules, which is, of course, the German translation for distance, hygiene, and face masks. So in Germany, since end of April, we are obliged to wear face masks when we are in public transportation, the supermarket, and wherever. And we all know, of course, about the social distancing and the hygiene, which are important to fight against this virus. Today, I would like to give you 3 examples. How does accreditation help in not preventing, but fighting against the transmission of this virus? So the first example will be from our standards for hand hygiene. The second example will be from infection control screening and monitoring. And the third example will be from emergency preparedness. So here you see a copy and paste from our online standards. Therefore, you see that the structure is a bit different to the slides I had before. So accreditation means, as you might all know, that you fulfill and follow certain standards which are accredited, checked, evaluated, assessed by a third party, a neutral third party. So here are some examples. You see a coding, ICHP, which stands for Infection Control, Hygiene and Prevention. And the first standard for our standards in infection control is hand hygiene processes. So, and we forced the organization with number 1, the implementation of 5 moments for hand hygiene published by WHO is assured throughout the healthcare provider. And then we see the 5 moments of hand hygiene. So when we say hygiene has an important part in the prevention of COVID-19 transmission, here hand hygiene is an important part, and standards force the organization to follow it. The second here is, as you see for 1.2, regular training on hand hygiene to caregivers is ongoing and documented. The third is measures, evaluation, assessment, and monitoring of correct hand hygiene are taken and corrective actions are implemented. So those organizations who are working with those standards every day, for them it's nothing new that in COVID-19 times we are all forced to follow hand hygiene in a very careful way. And number 4 here says information about the why and how of proper hand hygiene is provided to patients, relatives, and visitors. So it's not only that the healthcare staff in the hospital or in the clinic needs to follow, it's also that the organization should, the hospital and clinic should inform patients and visitors how to do it properly. And finally here, availability of and access to hand disinfection for staff, patients, and visitors is assured to support proper hand hygiene. So this is the first example saying accredited organizations follow hand hygiene processes, and of course non-accredited will follow them as well. But here it is given by standards how to do it in a proper way. The second is also from the same chapter, infection control screening process and protocols. The first is about a database about nosocomial infections, which is a bit different from what we are talking today. But number 2, excuse me, is the healthcare provider has protocols including respective assignments of clear responsibility for infection controls. So that means that we have a team in hospitals who are dealing and following infection control and prevention every day, and not only when we face a pandemic or an epidemic or other problems. We forced organizations to have guidelines on protocols for the admission of potentially infectious domestic or international patients. So this means you have to be careful always, and not only in COVID-19 times, that there is a potential infectious patient, and you have to have protocols and guidelines in place. And this is based on the organization's risk assessments. And these guidelines and protocols include, where applicable, patients from countries where we have a higher risk, or of course coming from other hospitals, ICU, home care. We see COVID-19 in Germany and in many other countries, that when we have home care organization, nursing care homes, that we have a high number of infected patients admitted to the hospitals due to the high-risk patients in this environment. We want that hospitals have an active infection control committee. So we have the responsibilities here, and an infection control committee should meet on a regular basis, and determine of interventions for infection controls should be based on the risk assessment and adequate planning by this infection control committee. And last but not least, for this group of standards, number 2, screening for and identification of multi-resistant pathogens is based on current international evidence. So on a day-by-day, week-by-week, month-by-month basis, the Infection Control Committee, all respective responsibilities, follow up and see what's going on in the world. The third example I want to give you is from facility management and services, and this is risk management, safety and security. And here, as one example, the healthcare provider plans and provides a safe and secure physical environment in the facility through an implemented risk management and respective auditing, inspection and monitoring. Security measures are in place to provide a secure environment for staff, patients, relatives, and visitors. So you are obliged here, let's say in quotes, that you have plans and that you on a daily basis provide a safe and secure physical environment. And this is supported by another category of standards, which we call the emergency preparedness. So based on your organization's risk assessment, and as part of your risk assessment management and the communication with local authorities, possible emergencies and any kind of disasters are identified, classified, and respective procedures are in place. So here we talk about emergency preparedness, respective actions which are based on risk assessment. And of course, the COVID-19 pandemic, nobody could foresee. And I'm quite sure that in most of the emergency preparedness plans and associated documents, COVID-19 doesn't play a role. But organizations that have an emergency preparedness plan already, they just adjust, like it also applies to the other examples I gave you for risk assessment, risk management, and the hygiene and infection prevention measures. So the current or the implemented measures may need to be adjusted, and you don't start from scratch. And in the case of emergency preparedness, for sure for the future, we have to add a chapter or a part where we talk about pandemics internationally, like COVID-19 as an example. So to summarize, how does accreditation help with standards and regular checks by an external neutral organization is that hygiene and infection prevention standards are already implemented. And this means we have more or less complete policies and procedures already in place. Hand hygiene, one example. We do have trained staff. So we can assure that the organization or the staff of the organization is compliant to what is needed also in COVID-19 times for hygienic measures. We have already implemented a quality culture. So we know how to do quality management, how accreditation works, how standards are implemented, how they are monitored, and the monitoring tools are already in place. For hand hygiene, this means observation, unannounced or announced. For the disaster management and preparedness plans, they are already in place, as I mentioned. So here we may need an adjustment instead of an unsystematic reaction, as I call it. So we know what to do. responsibilities are clearly defined in such plans, and we have responsive committees in bigger organizations who then deal with these plans. And there might be other reasons and other points to be added here, but due to the time, I kept it as short as possible. So this is, of course, what I share now with you is let's say, my opinion or our experience from working with hospitals also in COVID-19 pandemic times. But if you are interested in learning more, the colleagues from the Jordanian National Accreditation Body just published a kind of white paper, and they did a survey. They did interviews with accredited and non-accredited healthcare institutions in Jordan, and they found exactly in the interviews what I just presented to you from our experience as well. So you see here the source on the slide. If you want to see the whole article published by the colleagues from Jordan, please feel free. The presentation itself is shared afterwards. And if you want to go into details, this is a good article. And of course, I'm available for any questions, comments later on. With this, I would like to thank you for now. Looking forward to all your questions and comments. And you also see my contact details here to get in touch with me personally if you wish. Thank you very much.
Great, thanks Claudia. That was a great presentation. So what I would encourage people to do right now is if you have any questions at all that you'd like to ask, you can type them into the chat box. Oh, I can see one's already appeared. So Claudia, the first question is from Federica Zavataro, and she asks, in your experience, did existing infection control standards work for COVID, or did they need to be updated?
Great question. I think the current standards work quite well, but what we experience, and this is why we developed some standards, which I did not talk about, is to fill the gap, what is missing. So the existing standards work well, no doubt, but for COVID-19, because of the social distancing, we have to keep, we added a few standards also for infection control and hygiene, which are available free of charge on our website. So if you Google it, if you go on our website, so there is a minor gap which has to be filled for sure.
So Claudia, I'll add that some of the links that you mentioned and the experience of the resources from Jordan, we'll be able to put them on the full information that we put on our website that summarizes this presentation, and it will also equal to yours. I can see another question from Annabelle Sibhom, and I'll get to that in just a second. But I'll just ask about the way that you've updated the COVID ones. Are these, so you control the standards and then you make the addition, and then that is inherited by the hospital, or do you encourage the hospitals who have the standards to each individually update them?
Yes and no. So the first part, we have complete accreditation programs for hospitals and clinics. This is one part. Now in the COVID-19 pandemic, we were contacted by hospitals and clinics that are accredited by us, and they ask us, okay, we had to close some of the departments and we have to reopen them. So we are in a new situation and the accreditation standards might not completely help here. Can you help us? What do we need to do to restart our operations as a dental clinic, as a reproductive care clinic, etc., or as when hospital departments had closed? And based on that, we developed additional standards. So they are, let's say, an add-on for our customers, but they are available free of charge. This is our contribution to the COVID-19 pandemics, that we say we also have financial challenges all over the world. So we develop these standards and you can just download them from our website. And this will fill the gap for what is implemented and what might need to be added. So this also includes standards for telemedicine, because telemedicine, nobody is wrong, but not many people were familiar with telemedicine. Doctors didn't like it, patients didn't want it. So today, everybody is using teleconsultation. So we added standards for this, which were not needed before, not only infection control.
Right, okay, so there's a few more questions, I'll get to them. Yeah. And when we ask those questions, I'm also launching our second poll, which is asking about your experience with accreditation. So now that you have a sense of accreditation and how it works, feel free to answer that, and I'll share those responses shortly. So I'll come to now the question, sorry to make you wait so long, Annabelle Sebon, who asks, Dear Claudia, do you have direct feedback from hospitals using your standards during the pandemic and others which didn't?
So the answer to the first part of the question is, do we have feedback? Yes, definitely, because we are in continuous contact with our customers at this moment. Since we can't visit them, of course, we are in close contact and use the media we use today, like Zoom and all the other platforms. So yes, definitely, we do have feedback. Yeah.
And what has that feedback indicated? Like, has that given you a way to compare them? I mean, obviously, your whole presentation saying that standards do improve, using them enables you to have a better response. But is there anything else you've heard from that feedback?
Yeah, I mean, what we see is also in combination now with these COVID-19 standards I mentioned. So the organizations who are currently working on formally implementing them, because there is a certification program for it, they gave us the feedback, said, yes, some of these standards we have already implemented because we follow the accreditation scheme. On the other side, there is no doubt that now more and more, of course, governments have their regulations and guidelines, and they are published. So this also forces organizations to implement the guidelines and the new regulations in the respective countries. So all is coming together, and the more help, let's say, by standards, by regulations is provided, the better the organizations feel prepared and ready to receive more patients again, and how to deal and organize the structure within the hospital. Okay,
great. So to reflect that, we've got the responses to the survey. So we asked, what is your experience with accreditation? We had 5 people had a good experience. We've had 2 who had a bad experience, and 8 haven't had an experience. So at least it's favourable. It shows that depending on the system, obviously this is a very general poll, people are having a good experience, but the bad ones would be also interesting to learn from. No doubt, Claudia, you're always learning from.
Definitely. Yeah, I would be very interested to learn about the bad experience. It's always nice to hear about good experience, but bad experience should be a good experience. So I would be very interested to learn about that. Yeah.
If you did have a bad experience, you were one of the people that ticked that box, and you have a question about that or a comment about it that you'd like Claudia to give her expertise view on, please feel free to type a question in. I'll go to Roberta's question. She says, Dear Claudia, how do national and international standards differ?
They might not differ when it comes to infection control and this part, or for patient safety. Then national and international standards, especially if they are accredited by the accreditation organization, which is called ISQA. So then we follow all the same rules, and we have the same sources like CDC, like WHO, like ICRI, like others. So they might not vary. Our experience is that national accreditations often are not that comprehensive. They don't need to be, because they focus on the national accreditation. And what we see is that our standards also include different cultural backgrounds. So international patients, patients living in the country but having other religious or cultural background, which needs, of course, also a different communication when we talk about the treatment and the services to be given. And this is rather than shared with the international accreditation standards.
Okay. All right. So people might use both. Is that an option?
Sorry, again?
Might people use both?
Yeah, I mean, yeah, sure. So that's what we recommend. It can even be that you go first for a quality management certification. We all know about these ISO norms, so this can be a good basis. And then if you want to qualify yourself on an international basis, you go for international accreditation. Yes, for sure. It's a question what your expectations are, and based on the expectations you have, what you want to achieve, what should be your added value if you apply for it, then you choose the body which fits the best, definitely.
Great. I've just posted a link to the evaluation. We do a very quick evaluation. It literally takes 90 seconds. If you go to the chat box, please click on that link and answer the questions. The evaluation is your chance to give your applause to Claudia, which we can't really do online. So it's a chance to rate it, to give her any comments. Also, a lot of the topics that we choose in these webinars come from the very feedback we get from these. So please spend the 90 seconds. We've got time for a couple more questions, and one has come in from Ellie Breedveld, who asks, thanks for your great presentation. Standards and procedures are very good to have in place, but quality is more than that and more than safety for the patient and employees. There are also other values like quality of life. Do you also have experience with that?
Yeah, I totally agree. I mean, and this should be also part of accreditation. So we are talking about patient experience. We're talking about quality of life. We are not talking about what is only measurable and what we can monitor, etc. So a patient is a patient, it's an individual, and we have the standards can help you to be safe on your everyday routine and to be able to focus on the patient as a human being. And quality of life is definitely part, and this is what we try as part of our accreditation. We have different standards, how to include patients in the decision making, in the taking care, how to include the family. So these are standards which were not part of today's discussion, but definitely I 100% agree.
Just encouraging people to please fill out the survey. Claudia, I'm looking at the survey responses come in, and so far this is rating as the best, trending as the best rated webinar so far. So well done. You've got the highest trending score so far. In fact, all of our webinars get at least a 4.5 stars out of 5, but so far you're on 5-star average for everyone. So well done.
Thank you very much to everybody.
Kelly, thank you for your answer. And then Francois Xavier Léry asks you, are some accreditation mandatory in some countries, e.g. with social security systems?
Yeah, so in international accreditation, as far as I know, is always voluntary, but national accreditation schemes are mandatory in some countries, definitely, yeah.
Okay.
And not all countries do have national accreditation, so in these cases, the only option is to go for an international accreditation.
Okay, terrific. Okay, so that's about all the time we have for the questions. And so I just want to wind up now. We will be making this available on our website, as I mentioned. If you haven't filled out the survey, please do that now. You can follow us on our social media. So our social media is at EHMA Info on Twitter. And if you want to have more discussions like this, we've got these webinars happening every 2 weeks at a minimum. And then there's our annual conference on the 17th to the 19th of November. You can find all of that information by looking at our website. And we hope to see you at our conference and at our future webinars. Claudia, thank you so much, Dr. Mika, for joining us today and for that great presentation. I really appreciate your time.
Thank you very much, and thank you everybody for joining us for today's web seminar. And yeah, I'm looking forward to keeping in touch.
Great.
On all the channels we have available.
Yeah, great. It's a lot of channels. So we'll see you soon. Thanks for your time, everyone, today. All the best and take care.
Thank you. Bye-bye to everybody. Bye-bye.